North Norfolk and the Lib Dem health spokesperson. Therese Coffey is Deputy Leader of the Commons and the Conservative MP for Suffolk Coastal. And for Labour, we have Gavin Shuker, who's the MP for Luton South. Welcome all. First of all, Norman Lamb, you've called for an all-party commission to try and sort out some of these issues within the NHS. Today, the government say they don't want to be part of it. How disappointing is that?
Well, they're deluded if they think there isn't a problem. I understand that Lord Pryor said this in Parliament, but, you know, it sounds like they're in denial. Just consider this. We know that demand is rising massively because we're all living longer and we're living with multiple chronic conditions often, and this costs a lot of money. And yet, between now and 2020, we're planning to spend a reducing proportion of our national wealth on health. Does that make any sense at all? It's madness.
You have been a health minister. You've worked with the Conservatives in government. If you couldn't sort it out then, why would an all-party commission outside of being in government make any difference?
Well, I made the case in government and publicly for additional resources for the NHS. We got extra money for this financial year now. But this has been the toughest settlement for the NHS in its entire history. We've been obviously trying to get to grips with public finances. But there are big issues. Your report was very good in exposing the problems, but it didn't mention social care. We have massive problems in social care. The Health Foundation reckons there will be a gap of at least £6 billion by 2020 with reducing numbers of people getting support in home. This is elderly people, people with disability. And if you don't care for them at home, they end up in hospital. So the whole system is dysfunctional. And I think, you know, it was 1948 that this system was invented. We need to take a fundamental look at whether we bring together the health and care system to make it more effective.
Therese Coffey, isn't that the case, that it's a problem with social care, and we're seeing primary care, not enough GPs in many areas across the region, including in Suffolk, and that's leading to increased pressures on hospitals?
Exactly
so
right.
Even though hospitals have more money, they can't cope with the demand.
Yeah.
I think there's a variety of things going on. GPs are at the heart of the CCGs. They're making clinical assessments. There are some unpopular things happening in my own constituency. 2 community hospitals are closing. But this is being done by clinical management saying we want to care for people in the best place, and that could often be at home, as well as keeping open some community hospitals as a step-up, step-down kind of situation. I mean, this government is backing Simon Stevens with the plan, putting more money into the NHS as it happened
but not
before.
the sort of 30 billion that lots of people talk about being needed.
Simon Stevens put that forward. Actually, both the Liberal Democrats and the Conservatives stood on a platform at the general election not long ago, saying that's what we back and that's what he's asked for. I mean, this is an ongoing.
We also argued the case for a fundamental review.
This is an ongoing situation within the NHS. It is very precious to the people of this country. In terms of GP shortages, I think there are strategic challenges about that, and there have been some initiatives, haven't there, I think started in the last year. I think there's a wider challenge for several public sector professions coming out to more rural parts of our country. I don't think that's unique to doctors.
Gavin Shuker, would the Labour Party work with the others on an all-party commission? Because at the last election you were promising less money than these two, weren't you?
Well, for the NHS, but more broadly, as Norman actually outlined, this is a much bigger problem than that. It involves social care, and yeah, I think we've got to take a cross-party approach to it. Having said that, bear in mind that in the last Parliament, the Andrew Lansley reforms, backed by Norman, backed by Therese, were meant to deal with this problem. You know, we had an enormously difficult period in the NHS, which we're still living out the other side of, this unnecessary top-down reorganisation, but it was promised to solve many of the problems we're talking about today. It was a wasted opportunity, and I fear the reason why so many GPs do not want to go into practice here in this country is because of the attitude of the current Health Secretary making this issue about them, when actually it's about the governance arrangements in the first place.
Doctors out on strike last week, Labour Party were supporting them. Was that the right thing for doctors to do? Because hundreds of operations were cancelled across our region.
In my opinion, it was completely the right thing to do. I completely back the junior doctors. They haven't gone out on strike for more than 40 years. Government has engaged in this in a very poor manner, and I appreciate it is difficult for those people who've had their operations rescheduled, but no one chooses voluntarily to withdraw their labour unless there is a compelling reason to do so.
I mean, I think Gavin's right. This transcends narrow party politics, and this is an absolutely essential national institution. Everybody knows that in the system that the amount of money promised so far up to 2020 isn't enough, And we ought to be able to just have a mature debate about how we
but you were in a
provide that
government that
funding.
made cuts to local government services. Lots of those services provide social care to elderly people in Norfolk, Suffolk, across the region.
And we all know what a nightmare we had with the state of public finances, and really difficult decisions had to be taken. But what I'm saying now is where we are, and if we want these institutions to survive and for people to get care when they need it, we need something fundamental. And the government ought to be willing to embrace the offer from other parties to come together to solve these really difficult, intractable problems.
Therese Coffey, have the government messed up a bit on the doctor's contract? What do you think about this negotiation? I know the negotiations are ongoing, but there seems to be an awful lot of public support for the junior doctors, doesn't there?
I'm pleased the BMA have decided to suspend their future strikes, because the heart of this is about patients. Patients don't choose when they're going to be ill. And it is right that we try and have more of a 7-day NHS, so that if you suffer from a particular thing and you go into hospital, that you have
Do we not have a 7-day-a-week service anyway? Because that's what doctors say, don't they?
I would suggest that we have a 7-day-a-week emergency service. But I appreciate there are other things that need to be done in order to make sure that if you have the same chance of success in an operation, it's not just about the presence of doctors and nurses on a ward. It's not. There are other things more than that.
To get people out of hospital.
But I would suggest that this is the right thing to do for patients. That's what we're focused on. I know doctors are too, but we are disagreeing on the terms and conditions about how we reach that 7-day. But I'm pleased that the strike has been suspended.
Switching to